Okay, let's have a look at what's happening on Facebook today.
You literally cannot mandate somebody to wear a mask knowing that that mask is killing people.
And ma'am, as a doctor, I really have many question marks about your degrees and what you really know.
Want to throw God's wonderful breathing system out the door.
Every single one of you that are obeying the devil's laws are going to be arrested.
Sorry, what? Hello and welcome to another TLDR video. With countries beginning to loosen restrictions, including here in the UK, where social distancing rules have been reduced from 2 metres to 1 metre, discussion has turned to the use of face masks. Be it whether the science has changed since the beginning of the pandemic, to whether wearing a face mask can come with some potential health risks. So in this video, we're going to take a look at why the guidance has changed, why people don't want to wear masks, and what the truth is behind wearing a mask or face covering. Before we get into that though, if you haven't already, please subscribe to the channel. We're covering a whole variety of news topics, from COVID stories to non-COVID issues. And if you subscribe, you'll be helping us out a whole bunch, and you'll also be more likely to see our stuff going forward. Also, if you're from the EU or US, or if you're just interested in those countries, then be sure to check out the special channels we have dedicated to them, which publish content exclusively to TLDR EU and TLDR US. There's a link to both channels in the description, so you can subscribe now to make sure you're getting all of the content from us. So let's rewind to the beginning of the pandemic. From a relatively early stage, most people are taught to cough or sneeze into their elbow or tissue, with the NHS putting out the slogan, "Catch it, bin it, kill it." With that in mind, many thought that wearing a face mask could help catch droplets and slow down the spread of COVID-19. The issue being that there was no conclusive evidence to support or disprove this when related to this brand new strain of the coronavirus. So back in April, the World Health Organization's position was that currently there's not enough evidence for or against the use of masks, medical or other, for healthy individuals in the wider community. Something that was echoed in NHS advice for months, which stated, face masks play a very important role in places like hospitals, but there is very little evidence of widespread benefits for members of the public. However, on the 4th of April, the US Centers for Disease Control and Prevention reversed its earlier position against wearing masks and published new advice telling the general public that everyone should wear a cloth face cover where they have to go out in public. Following this, on June 7th, the WHO updated its guidance too, saying that masks should be used as part of a comprehensive strategy of measures to suppress transmission and save lives. The WHO Director General said that in the light of evolving evidence, the WHO advises that government should encourage the general public to wear masks where there is widespread transmission and physical distancing is difficult, such as on public transport, in shops, and in other confined or crowded environments. So where did this change of heart come from? Well, a German study released in early June suggested that face masks could slow the spread of the virus by up to 40%. In a discussion paper for the Institute of Labour Economics, strong and convincing statistical support for the use of a face mask was found. Depending on the region we analyse, we find that face masks reduce the cumulative number of registered COVID-19 cases between 2.3 and 13% over a period of 10 days after they became compulsory. Assessing the credibility of various estimates, we conclude that face masks reduce the daily growth rate of reported infections by around 40%. Although this has to be tempered by the fact that there are a number of variables at play. Dr. Antonio Lazzarino from University College London and founder of Epistarter said that this is a non-experimental study, so causal inference cannot be claimed. There are too many assumptions. This isn't, however, the first time that a controversial study has led to discussion on the matter. The report published by Delve, a multidisciplinary group convened by the Royal Society, concluded that face masks could offer an important tool for contributing to the management of community transmission. Our analysis suggests that their use could reduce onward transmission by asymptomatic and pre-symptomatic wearers. Others have invariably raised concerns about the study. Dr. Simon Clark, Associate Professor in Cellular Biology at the University of Reading, told The Guardian that the report falls short of delivering new evidence and too casually dismisses precautionary principle when addressing the possibility that masks and coverings could have negative effects on people's behaviours. Until more evidence is delivered in either direction, that's all the advice can be based on: opinions. All that being said, there is some apprehension when it comes to wearing face masks. An article which appeared in a Nigerian newspaper, which first appeared in Spanish and was widely circulated throughout South and Central America, suggested that prolonged use of face masks could cause hypoxia, where your body doesn't get enough oxygen, and recommends lifting the mask every 10 minutes, with Dr. Dennis A. Castro B. claiming that breathing over and over exhaled air turns into carbon dioxide, which is why we feel dizzy. This intoxicates the user, and much more when he must move, carry out displacement actions. It causes discomfort, loss of reflexes, and conscious thought. It generates great fatigue. A separate graphic spread across Europe on Facebook, again suggesting that prolonged usage could cause hypercapnia, when too much carbon dioxide is in your bloodstream, as the wearer begins to inhale their own exhaled CO2. While no one claims that wearing a mask can't be uncomfortable sometimes, both claims are demonstrably false. When it comes to the claim of hypoxia, Dr. Richard Mihigo of the World Health Organization told the BBC that non-medical and medical masks are made from woven fabric that has high breathability. The masks allow you to breathe normally and prevent particles from passing through, going on to say that lifting the mask, as suggested to allow you to breathe, could expose people to contamination. When it comes to the claim of hypercapnia, too much CO2 in your blood, Professor Keith Neal, Professor of Infectious Diseases at the University of Nottingham, said that this simply won't happen unless there's an airtight fit and you rebreathe your own air, as CO2 molecules are far smaller than droplets containing the coronavirus, and thus aren't in any way trapped by the breathable materials that masks are made from. That's not to say that masks are the be-all and end-all, and will solve all coronavirus-related problems. In fact, N95 face masks, surgical face masks that are typically reserved for those in the health sector, do have some side effects. As John Zhu, a medical engineer research scientist at Stanford University working on modifying the mask, said, N95 masks are estimated to reduce oxygen intake by anywhere from 5 to 20%. That's significant, even for a healthy person. It can cause dizziness and lightheadedness. If you wear a mask for long enough, it can even damage the lungs. Although it must be stressed here, this is only of a concern for extremely long stints with an N95 mask. Standard face masks and cloth face coverings are not susceptible to the same issues, something that the CDC was at pains to stress. While the science remains unclear as to the sheer benefits of wearing face masks, some governments were initially worried about what would happen if they advocated for them, with the concern being that some people may believe that by wearing a mask they're safe, and that a mask negates the need for other measures, notably social distancing and regular hand washing, with the World Health Organization noting that it's important to note that masks should only be used as part of a comprehensive strategy. Masks on their own will not protect you from COVID-19. People should also clean their hands frequently and maintain a distance of at least 1 metre from others. By a similar token, some government scientific advisors believe that forcing people to wear masks could spread fear and anxiety, and that the general public would be too ignorant to use them properly. Days before the lockdown in the UK was started, the UK's new and emerging respiratory virus threats advisory group discussed the use of face masks, with minutes from the meeting stating that members raised concerns around explaining why face masks were accessible to healthcare staff but not the general public. Lisa Ritchie clarified that this was discussed at a previous meeting, and that the difference is that healthcare staff are trained to use the masks and know when to change the masks when they become soggy or contaminated. However, with the general public, there's no control over how they would use surgical face masks, so they may use the same one for a week, which is inappropriate. In spite of this concern from public health officials, according to a series of polls conducted by YouGov on behalf of the University of Oxford, 53% would definitely wear a face mask in public places if advised by the government, with 23% of people saying they probably would, 11% as a maybe, 7% saying they probably wouldn't, and 4% saying they definitely wouldn't. But what do you think? Are you already wearing a face mask, or will you do so when advised by government? Are you concerned about the medical effects of wearing a mask, and have you seen fake news about masks spreading online? If you have, be sure to let us know in the comments below. As always, you can also get involved in the conversation over on Discord. And if you'd like to fact check anything we've said in this video, be sure to click the link to our website in the description, where you can submit a correction that you'd like us to make. Also, be sure to subscribe to the channel for more updates on this and other topics, and you can find more from us across all social networks simply by searching for TLDR News. Special thanks to Patreon backers who make videos like this one possible. And if you want to support us and see your name listed at the end of videos, you can back us on Patreon by clicking the link in the description.